So everybody, we have 9 speakers tonight. 8 of them are here in person. The one person that isn't is our Lorraine Johnson. She's the development lead, and Lorraine has undertaken a video tour of the Health Hub space. This is as recent as July 9th. So we will share with you our current state of that second floor. This is what it looked like about a year ago. Essentially a blank canvas, ready to be developed. So this is Lorraine Johnson. Lorraine was the previous executive director for Cottage Country Family Health Team. She retired and she continued to support the development of the Gravenhurst Health Hub. Lorraine came to Cottage Country Family Health Team after many years of working in various healthcare sectors, both as a primary care nurse practitioner and in healthcare management. Her background in community, acute, and primary healthcare provided the experience to lead and develop the multidisciplinary team that currently exists at the Health Hub. Lorraine is passionate about healthcare planning at the community level to strengthen equity and access to care. Now, before I play this video, I just want to mention that collectively, this is a fun thing that I do, and those of you that know me are going to shrink a little bit when I say use Tom Math to figure this one out. But we have over 250 years of experience in healthcare, and that experience is still current, sitting in front of you. So if they can't answer it, we'll go hunt down the answers for you.
I will come in. Lovely. Hi. Where are we? Who are you?
So I'm Lorraine Johnson. I'm the interim executive director, and I was the previous executive director when this project started. And Lauren is our new executive director that is starting this next week. Yeah. Lauren, go ahead.
Hi everyone, my name's Lauren Parsons. I am the new Executive Director of Cottage Country Family Health Team, and we're here touring the new hub space.
So welcome to the second level of Cottage Country Family Health Team's building here in Gravenhurst. And we're going to start you on a tour of this building. Previously, the entire upstairs was vacant space, so we've seen a lot of progress and a lot of change that we're hoping to share with you. So you're here at the elevators. This is the way most people would come up to the second level and enter on the main level and come upstairs. To our right is the female washroom. That's a mirror image of the washroom below on the main level. And to our left will be the male washroom, which again is a mirror image of downstairs. There are doors on both sides for the elevator. When people come upstairs, they can enter or exit on either side. And if we look to the other side of the wall, those windows are the atrium from downstairs. Right now, they're being covered for privacy of patients downstairs while we do our construction up here. But those privacy barriers will come off, and there'll be natural light from downstairs that will come up into this whole space up here. It is a square, and the hallways go around the exterior of the whole upstairs. That's really nice because people who have the units will all have some natural outside light, and the entrances into those units will be in this interior hallway. Okay, so we can see some of our construction work in progress here, but we'll walk past this. And our first unit on the right here is Dynacare space. So we placed Dynacare very close to the elevators and to the second level entrance because we anticipate that they will have a large number of people utilizing their service here in Gravenhurst. Bracebridge is the only site for people to get blood work done at Dynacare if they're not patients of the providers here at Cottage Country. So our goal is to provide service to everybody in the community, that diagnostic imaging services and laboratory services. So this is Dynacare's space, and again, Dynacare has started to work with the architect. Their space is designed. They've selected a contractor, and they will begin very soon to do the construction within their unit. This unit here is about 900 square feet, so it's one of the smaller units. Maybe we will look at the second unit on the right on this side before we go to the left. The second unit on this side is about 900 square feet as well. And as yet, we haven't designated the service that will be in this suite, but we do have one suite that's unaccounted for that we're looking at what services would the community need and what would be appropriate to bring into the hub space that mirrors the other healthcare services that we have here. This is a large, this was to replicate our boardroom on the main level so that that boardroom can become either space for primary care or for diagnostic imaging downstairs. It's actually larger than our boardroom downstairs, but rather than create two separate meeting rooms, we've left it open and we plan to put in a wall that can be moved back to either have one big open space or two small meeting spaces. Come down the hall, we're now at what I think of as the back of the building. That's where Bethune Street is, and it's the opposite end of the elevators and our atrium and the main entrance on the main floor. So there are this space here, and into that space will be the health hub. This is where staff from our main level, program staff, hospice, family connections, and the new staff with our new funding, as well as the specialist services and the nurse practitioner primary care services will all come up into the hub. And so the footprint for the hub has actually increased from our original plan because of that staffing change. So there will be actually 3 entrances into this space. This first entrance will take you into a common waiting area and an admin area. And that space will be to the wall here. You can come in this door, waiting area, reception against the wall. And then, excuse me, down this hallway, on both sides, and at the end will be offices. And so this will be program staff, pharmacist, dietitian, nursing, social work, and a blend of staff that exists downstairs and new staff that are coming to provide services to the community. This is the entrance, reception, waiting room for the entire hub space. When we move this way, left into the hub space, you have lunchroom, hospice, family connections, and nursing at that wall that is going to support the specialist clinic and the primary care nurse practitioner clinic. Again, this wall here will be gone, and this will be a hallway into the third sort of section of the hub. And if we think about the walls, and you look at the walls that exist now, this is actually 3 units that have been brought together to be one big hub space. It's been designed in a way that if in the future we need to create 3 units again, we still can. And so this one big space, if the future changed, our needs changed, the community needs changed, we could reconvert this into 3 separate units. So third entrance, and this space here is being designed for 2 nurse practitioners that are on the main floor that will move up, 3 additional nurse practitioners that will be hired with our new funding, and create a primary care nurse practitioner hub that will serve both attached and unattached, and provide services to patients that currently don't have doctors, and we'll try and get them attached, provide their primary care needs, as well as preventative care, get that booked up, and have those patients in our health record ready to join a family practice once an opening comes available. In addition, we are planning for 2 specialist clinic rooms here, visiting specialists. So currently we have 2 pediatricians, one psychiatry, 1 general pediatrics that come, and they currently utilize physician space on the main floor. We're creating a space for visiting specialists so that we can support specialists to come to the community. Our admin our admin staff will support them. There'll be some infrastructure support for visiting specialists here on site. And our last space as we move down the hall back to the boardroom is now on our left, because we've just done a square. And here's our atrium again, looking downstairs. We're now looking downstairs from this side. And our last room is space that has been designed for ParaMed. So ParaMed is a nursing service that runs a clinic. So people come to ParaMed to receive IV care, dressing changes, kind of the way nurses used to visit in the home. A number of years ago, the ministry established nursing clinics that people go to, so it facilitates and supports a higher volume of patients if patients come to the nurses. That clinic has been downstairs, I'm thinking it's 4 years now, but they need to move into a larger space because the space they moved into probably wasn't big enough to begin with, and so the plan has always been to have ParaMed move to the 2nd level, create more space for their service and their providers.
So we're kind of right back to the beginning now?
Yeah, we're right back to the beginning. So when we come around the corner, you're back to the elevators and back to the main public washrooms on the 2nd level. And the atrium to downstairs. I think it's really going to be hard to envision how nice it'll be when the covering comes off the atrium. One of the comments today has been around signage. We're not quite there in terms of figuring out what signage will look like, but when you come off the elevator, there'll be things that will direct the public in terms of which way to go. What I think is really important to share with everyone is how important the community effort and the Rotary effort was to this project. So this building was built by the ministry. I think it started in 2008, and they were moving in late 2009, 2010, and the entire upstairs remained unfinished until now. I was the executive director for almost 5 years. Looked at how do we develop this space, how do we get the money to start to move forward with it. And there were so many barriers to that because the ministry will support the family health team for space for their staff, but there wasn't support to put hallways in and bathrooms in and get us to a point where you could actually develop that space for staff. And so we had this 12,000 square feet with nothing in it, a need within the community. Downstairs on our main level, there is no space to bring in primary care providers because every room is utilized. And we needed more space for primary care providers, and we needed a way to move forward with this building, which we didn't have. And it was with the support of Rotary to take this project on, and the community to provide the support that Rotary was asking for to get us to this point. And so I'm amazed and delighted that we've got to a point where we can say to Dynacare, come and develop your space. We can say to the ministry, you've given us new staff, we need help to develop the hub space because we are ready, and we wouldn't have been ready without the halls, the bathrooms, and the infrastructure to create those individual units. So an eternal gratitude and thank you from myself and from Cottage Country, from the providers, from the staff, for how we've gotten to this point.
So everybody, before we continue on, I'd like to acknowledge the fellow that put that together. He's a Rotarian, a volunteer, and he's our current videographer down at the front here, Chris Taylor. Okay, so we felt it was important to take a lot of time to show you where we are with the space, and that sets us up for the rest of the presenters who are going to speak to all the different aspects of this project. The next person up is Brad Stoneberg, and Brad is the site manager. He's the guy that's overseeing this project. He operates a healthcare real estate service specializing in the healthcare real estate sector. He's a licensed broker, and his experience includes work at Humber River Hospital, Sunnybrook Health Services, Trillium Health Partners, Scarborough Health Network, William Osler Health Services, McMaster Health Services, Joseph Brant Hospital, St. Mary's General Hospital, Women's College Hospital. He's extensive management, project management experience and detailed knowledge on layout and functionality of medical clinics, that's his specialty, and suites including costing. Brad is currently the Cottage Country Family Health Team site manager. For this project, he oversees all aspects of the project on the second floor currently for phase 1. He works closely with the building committee, the architect, Cottage Family Health Team, and of course, the contractor. So Brad, before I let you off the hook, I'm going to ask a question. How does our new space compare with that of other communities?
In terms of what you've built here, it's amazing. The infrastructure that was in place already allowed me to start the project from a 50%, I would call it, versus what I would say is other places where they have to start with building the actual concrete. In terms of the response you've had from the community for services, from the doctors, the input and everything else like that, it's better than most, absolutely.
Okay, and we can take a couple of questions from the floor. We have our mic walkers. Does anybody have any question of Brad relating to the actual construction of the building?
Hello, I'm David Kellum, and I'm just curious, have we been dealing with local contractors to do all the work, or has it been done outside of our local area?
The process for the bidding was extensive. There was about 28 bidders. Of the bidders, most went to local trades and contractors to do the bidding, but we ended up selecting 3, shortlisted it, and they came down, and the selected contractor actually is using local trades. Not all local trades, but local trades.
So this next presentation, we've lumped all of the Cottage Country Family Health Team individuals together. That'll be Marcia Barnes, Lauren Parsons, and Dr. Keith Cross. So I just want to take a minute to share the bios of all of these people. I want to emphasize what we have put together here for you and what Cottage Country Family Health Team will look like with their help. So Marcia Barnes is an experienced senior healthcare executive with over 30 years of experience in the Ontario Public Service. She's held several leadership positions at the Ministry of Health, leading complex, transformative projects in primary health care and physician compensation, as well as Assistant Deputy Minister at Cabinet, I want to make sure I get that right, a Cabinet Office responsible for health, education, and social services portfolios. Marcia is currently the Strategic Advisor for the Muskoka Algonquin OHT, where she leads the governance, strategy, and primary care attachment work. Marcia is an active volunteer, currently serves on both the Cottage Country Family Health Team and the Rotary Club of Gravenhurst boards. She's a coveted member of both of those boards. She graduated from the University of Waterloo with a Bachelor of Science in Health Studies. She went on to the U of T and obtained a master's degree in health administration. And I am excited to introduce the new Executive Director of Cottage Country Family Health Team, Lauren Parsons. You will find that she's high energy, extremely knowledgeable, and she's probably blushing right now as I say this. So as I mentioned, she is the new Executive Director of Cottage Country Family Health Team, and this organization is going to take off. There's a tremendous amount of work, and we need a high energy individual to take this on, and it's going to be an exciting period of growth and transformation. Lauren brings over 10 years of healthcare leadership experience in public health, quality and patient safety, primary care expansion, integrated care, and health systems improvement. Before joining the health team, Lauren held leadership roles with Sinai Health, Muskoka Algonquin Healthcare, and the Muskoka and Area Ontario Health Team, where she worked with healthcare community partners to implement new models of care and improve access to local services. At Cottage Country Family Health Team, Lauren is helping to lead the organization's expansion across the region, including the implementation of new provincial primary care funding, the recruitment of additional clinicians, and the development of new and expanded services at the Gravenhurst Health Hub. Lauren is also a community member and has volunteered with the Health Hub's Marketing and Communications Committee. I've known Lauren for almost a year and a half now through her work as the chair of our Marketing and Communications Committee for the Gravenhurst Health Hub. Last one is somebody you likely already know very well, Dr. Keith Cross. He's the vice chair of the Gravenhurst Health Hub Committee. He's been a family physician in Bracebridge for over 40 years. He is the medical director at the Pines Long-Term Care Home in Bracebridge and the attending physician at the Beaver Creek Minimum Security Institution. He's a director of South Muskoka Hospital Foundation, and he participates on various committees for the Muskoka and Area OHT. So that's the three people that are going to present the next PowerPoint, and we'll take more than 2 questions. There's a lot of information to cover. I think you're going to find it very exciting, and you've heard enough of me talking. So how about I move right on here? Okay, over to you, Marcia.
This slide is a reminder of the vision we shared previously, to create local, community-driven solution that brings more healthcare closer to home. The Health Hub is more than a building. It is intended to create a practical turnkey space that makes it easier to recruit healthcare providers, expand local services, and better connect residents to care. This vision includes expanding primary care, welcoming visiting specialists, strengthening diagnostic and laboratory services, and exploring programs such as geriatrics, diabetes education, women's health, and expanding after-hours care. Not every service will begin at the same time, but the new space gives us the foundation needed to continue developing these opportunities. The renovation work is what makes this broader model possible. Our goal remains steadfast, building the opportunity to recruit enough primary care providers so every resident can have access to the care that they need. Lorraine's video has already provided a helpful look inside the building, so I'll keep this update short. In the fall of last year, the Phase 1 fundraising goal was achieved, and the renovation tender was completed within the original estimate that we anticipated. The construction contract was signed in January, and renovation work began in February. Phase 1 remains on track and on budget, with completion forecasted for sometime within the next few weeks. The architectural drawings for the Phase 2 leasehold improvements have been completed. Our first new community partners have been confirmed. Hospice Muskoka and Family Connections will be joining the Health Hub. We've reached an agreement with Dynacare regarding expanded laboratory services, and you'll hear shortly from Craig in terms of that expansion. As you've already heard, on April 17th, Graydon Smith announced $2.136 million in provincial funding for Cottage Country Family Health Team. That number we will never forget. This investment is intended to provide us with the resources to hire providers that will connect more than 5,000 new patients to primary care. This new operational funding will support primary care expansion across Bracebridge, Gravenhurst, and Wautah. Gravenhurst will receive a significant portion of this investment. The funding will support both the leasehold improvements at the Health Hub for the new staff and for compensation for 7 new clinicians and 2 administrative positions. The most direct way residents will experience this investment is through the new access and attachment clinic, which Lauren will now explain.
Okay, thank you, Marcia. So one of the most significant new services planned for the Gravenhurst Health Hub is the Access and Attachment Clinic. So the clinic will be supported by 3 new nurse practitioners, as well as 2 nurses, and will provide an initial connection to primary care for people who do not currently have a primary care provider. Patients will be able to have their primary care needs addressed within the clinic, while longer-term attachment work continues. Their health information, preventative care needs, and clinical history will also be documented within our electronic medical record. This means that when capacity becomes available within a primary care provider's practice, the transition can be a smooth one, as the patient's records and preventative care needs have already been documented into our system. This model benefits patients, but it also supports providers who are taking on new patients by ensuring that they receive organized and current clinical information. So we know one of the first questions that people will have is whether they can sign up immediately. So the intake process, as well as eligibility details and timing, are still being finalized. We will communicate all of those details clearly to the community as soon as they are confirmed. Attachment is one part of the model, and the broad goal is to create a more connected place for care. So I'll speak next about the additional providers, services, as well as partners that will support patients through the hub. So the Health Hub is designed to make healthcare easier to navigate by bringing providers, services, and community partners together into one location. A new social worker and care navigator will help patients and providers identify and access appropriate health care and community services as close to home as possible. So these roles will be especially valuable for patients who are navigating multiple services or who may not know where to begin. We are also introducing a new clinical pharmacist position through a collaboration with PharmaChoice. So that pharmacists will provide access to same-day assessments and treatment for minor illnesses that fall within the pharmacist's scope of practice. Importantly, the pharmacist will remain connected to Cottage Country Family Health Team's primary care providers, so that care is coordinated rather than feeling separated and occurring in different places. So next is DineCare. DineCare will operate a public laboratory service in a new clinical space on the 2nd floor that you saw in Lorraine's video. Their representatives will provide further information following our presentation. We are also very blessed and pleased to welcome Hospice Muskoka and Family Connections as community partners within the Health Hub space. Having these organizations located alongside primary care creates more opportunities for collaboration and helps support smooth transitions for patients and families. Overall, the objective is to place several services in the same building and create a more connected and coordinated experience for care. While these services help respond to current needs, the hub is also creating opportunities to build future capacity. So I'll now turn it over to Keith, who's going to talk a little bit about the proposed primary care teaching clinic.
So a primary care teaching clinic is an extension of a medical school within our community. We have been affiliated with the Northern Ontario School of Medicine now for about 15 years. We actually have an encounter next week with York University. They are very interested in our community as a satellite of the medical school that they will be getting in 2028. So as Grady mentioned earlier, the province is enlarging medical schools, NOSM is enlarging, York is enlarging, and all of the medical schools are enlarging. We would like to be a satellite for teaching postgraduate physicians in training. the great part of that, if we can make this occur, is that a postgraduate physician in training, as part of their training program, takes about 150 to 200 patients. If we had 4 to 8 residents, as they are called, physicians in training, that would give us the potential to have 600 to 1,500 additional folk locally cared for. Our Muskoka, Almac, and Ontario Health Team has prepared a proposal which we have submitted to the province, expressing our interest to so do. As I mentioned, we are already a part of the Northern Ontario School of Medicine, and York University is visiting us next week, and we are going to tour them through this site and also the Georgian College property in Bracebridge. Next slide, please. One of the other services that you saw in Lorraine's video was the specialty clinic. We already have some specialty programs on site, including pediatric psychiatry, and rheumatological services. We have been in communication, and we gave this in the presentation last year, with local specialists who vacation, and they think they could help us with additional care on a periodic basis. The beauty of that is that it takes away travel, because many people travel quite a distance for care. We think that a logical step in that process would be to have a nurse practitioner locally acting as a coordinator for that role, so there would be a liaison between the patient and the provider, and it would enhance local care. Next, please. So, next steps for us. You've seen the video of phase 1. At the back of the building, as Lorraine mentioned, is phase 2. We would like to complete that space, and you saw Bruce's funding requirements to make that happen. We think we're virtually there now. We need to continue to dialogue with the Ontario Ministry of Health to establish the appropriate agreements for the leasehold improvements, because they would be funding that space, because that would be actually the staff that Graydon mentioned that we were awarded the $2.1 million for. We would continue with recruiting providers, and you're going to hear from David Gravel later in the presentation how we have been successful in recruiting some folk to our community and hope to continue to do so. Lauren's going to help us get our NP program up and running this fall. And we will continue to work on developing the specialty program, visiting specialist program, and also the teaching clinics. And then we also need to secure an additional tenant for that one open space that you saw in Lorraine's video. So the focus is get the program going, recruit more providers, and launch the services.